What would be a funny thing to say to a surgeon before anesthesia kicks in 5 seconds later? The last time I tried to say something funny right before surgery, they were about to put me out and I said, "Go easy on me, doc. It's my first time." I gave a little chuckle and so did the doctor. He then picked up a scalpel and said, "Don't worry, it's my first time too." And then I promptly blacked out. My twin owes me big time for this one. They had a thing checking my heart and it fell off and it flatlined. I told them, "God damn it, you killed me." As they were pushing the drugs they asked me to count backwards from 10. All I could say was, "No." The room erupted in laughter and I was out. Right before I went under to have surgery on my septum, I was about to start counting backwards before they put the mask on. Does anyone need anything while I'm out? The last thing I remember was an all room full of people hysterically laughing. Here's my impression of my wife during 6. Full stop. Full stop. Full stop. Edit. I'd like to dedicate the success of this comment to my wife. May she someday awaken from the coma and or exist. I was being wheeled into emergency abdominal surgery once and my girlfriend was with me. We're rolling down the hall and they have the mask out to put me under and I pause and say to her, "Don't let them touch my D." The nurse smirked a little and they put the mask on me. In somewhat of a panicked fashion, I pulled the mask off, stared up at my girlfriend, and with full weight and seriousness told her they can look at it, but no touching. I heard the doctor laughing as the gas kicked in. I was being put under for a wisdom tooth extraction a few years back, and it was the first time I've ever had anesthesia. They used injection method rather than gas, so they told me to watch the fluids going in so I could gauge when I'd feel sleepy. I had this idea that I would say something like, "Oh no, doc, I've lost my eyesight," or something else preposterous. Before I could collect my thoughts I just immediately blurted Welsh my voice progressively getting lower, and passed out. Who's the guy with the scythe standing in the corner? If I don't make it through this, tell my wife I want her to be buried alive with me. As the anesthesiologist was putting me under, he just said I'd start to feel sleepy soon. I asked him, "Aren't I supposed to be counting back from 100 or something?" He replied, "I don't know. I must have skipped that class. Being an anesthesiologist must be awesome as you can always get the last word in." I once had to have my right hand operated on for a serious injury. Dr. Grace, will we be able to play guitar after this? Oh sure you will. Funny. I never could before. Double quote. The operating room feels silent. When I had my wisdom teeth removed and was given general anesthetic, I apparently said, "If this is what being on drugs is like, sign me up." He went and told on me to my mother. I asked for a tummy tuck while being wheeled in for a bowel resection. I said, "While you're cutting it open, just cut some off." Then when I was done my surgery, but still pretty messed up on drugs, I asked if I was skinny and then cried when my DR told me he didn't give me a tummy tuck. Same DR, different procedure. Terribly inappropriate joke. Had to have a colonoscopy, so they gave me some medication where I was awake. But like, it was weird. Anyways, I was feeling silly and told him first time doing anal on camera, and I'm not even getting paid. Awful lot of white people in here me, after being sedated for a colonoscopy. Last time I went under, as I started to fade, I said, "You're gonna have to drive." I'm ducked up. Probably came out, "You're gonna have a drive." I'm fucked up. I had just woken up after having my shoulder worked on. I was in and out of consciousness for a bit and just generally ducking whacked out. I guess I shifted in the bed and moved the blankets a bit and exposed myself as the nurse came in. She smiled and moved the blankets back. I apparently told the nurse, "You saw mine. Do I get to see yours?" My wife was in the chair next to the bed. You have to look the surgeon squarely in the eyes, and with a straight face, whisper, "I want you inside me." When I got my wisdom teeth removed, "Doctor, alright, so you feeling that sedative yet?" Me, "Yeah, a little bit. I bet I can stay awake though. How long can people usually fight it?" Doctor, not long. Good night. Me, blackout. I remember laughing when I woke up because that was the last thing I remember. If something goes wrong and I go into a coma, don't you dare ducking cut my coma beard. I tend to get massive erections while under anesthesia, but it's fine. Just tape it down if it gets in the way. Just before I blacked out, the anesthetist said to me, "This is the stuff that killed Michael Jackson." I actually did the same thing before both of mine. I managed to get out. "I'll see you in the future, doc," or something. Either way, once the drugs kicked in I didn't care. Edit, a word. I actually just remembered I didn't get to say anything the first time. As I was about to lay down on the table, they were stepping my arms down, and I at you not, the woman says, "Okay, put your arms out like a T." Yeah, it's like you being crucified. I only got out what? Then I woke up and looked at the first woman. I said, "I'm ducking hungry." "Wait, sorry." She laughed and gave me goldfish. Thanks for doing this. There aren't many surgeons out there who would operate on someone without health insurance. You can fondle me while I'm out if you want. To the surgeon and nurse, I just want you both to know good luck. We're all counting on you. Before going under for wisdom teeth, the doctor said I might feel funny. They pushed the drugs and asked if I felt any different. My asshole. And only my asshole began to itch like crazy. And it was hot. Not warm. Hot like I just ate peppers with my ass. I told them my asshole is itching like crazy. The assistant was really bad at holding back a laugh. The doc resisted mightily, but he too succumbed to my newly discovered butthole emotions. I had broken my wrist and was being put under to have 4 pins inserted. They gave me my anesthesia through a knife. I felt coldness spreading up my arm and across my chest. The nurse asked how I was doing and I said, "This must be what dying feels like." I heard her say, "Oh my god," then I was out. I beat the anesthesia. For the record, my wife does not like it in the butt. Because I said this before my surgery. My wife is a nurse who works at the hospital I was in. I don't remember saying this, but her co-workers remember it. Whoa, I actually have a relevant story that happened recently. As I was getting ready to go under, they were placing a device in my mouth to keep me from biting down on the scope they were going to use for the endoscopy. Think medical ball gag, but a hard plastic ring instead of a ball. As the gal was placing it in, I asked, "Wait, what's the safe word?" I heard a good amount of laughing as the world turned to black. Edit, a word. Yo, lem know if you see my phone in there. My surgeon told me to think of a happy place. Then he asked me where it was. The Simpsons kicked in, and I told him it was the happiest place on earth. Tijuana. I didn't stay awake long enough to see if he got the reference. Your wife has a great ass. Patient. Knock knock. Medical staff. Who's there? Patient. Nobody. Medical staff. Nobody who? Classic exit. I want my baby back, baby back, baby back. I want my baby back, baby back, baby back. Then the surgeon will be all pissed the whole time because you never finished it. As soon as you wake up, try and muster. Re-ibs. Chilies. How do you keep a surgeon in suspense? While going under, did I ever tell you how I got these scars? Coming to, that's how. Just a forewarning, but I am plagued by wet dreams. Pre-op Marco. Post-op Polo. There is another Sky Walker. Waking from anesthesia one time, I heard someone say his blood pressure is a little high. Then I mumbled that'd be the anesthetist's assistant's fault. They then kinda startled, asked quickly, "Why is that?" Becoming slightly more coherent, I continued with, "She's really hot." They all laughed and said he'll be fine, and released from theater. When I got my wisdom teeth out, the dentist's office was right next to a funeral home. I told the guy that if anything went horribly wrong, they could just take me next door. Mother and doctor were not amused. Related comment but doesn't really answer the question. My dad was in the middle of a surgery repairing some pretty nasty damage on his wrist after a skiing accident. He was under heavy anesthesia, but the surgeons were having serious trouble with the screws in his wrist, which apparently jarred him around enough to wake up. He noticed their struggles and managed to say righty tighty, lefty loosey. Then he passed back out. Hello darkness, my old friend. I remember being a celeb at a hospital after I said I love my girlfriend cause she got big titties. When I'd go in, I'd have doctors and nurses teasing me. I was 16 at the time. So after my dad had a triple bypass and was just waking up and they had removed the breathing tube, I was in the room with him. I said something along the lines of everything went perfect with your surgery, dad. No problems. My dad in his drug haze said that is because I am a perfect specimen of the human male, and it couldn't have gone any other way. Nurses were cracking up. Last time I went under, started to feel a sort of paralysis and couldn't move. Me, whoa. Did you give me something? Nurse, yes. Relax and don't fight it. Me, okay. But you should sell this stuff in the gift shop. Everybody laughs. Surgeon, are you okay? Me, yeah. But I'm disappointed there's no cake. Surgeon, laughing. On the recovery notes right, give the patient cake. Next thing I know I'm waking up in recovery with a slice of chocolate cake on the table next to me. Here's one that actually happened. My grandmother's sister was getting an epidural done for one of her children. When she came to, everybody involved couldn't stop giggling around her, and she had no idea why, until it comes out later that while she was doped, she had repeated one of my great grandfather's favorite problems of logic. If you're shoved up to your neck backward up a sheep's ass, and there's a bear coming to eat ya, what do I do? Do you pull your head in, or bite the sheep's ass to make it run faster? It's a shame he died before I was born, that man. I swear to God, if I wake up as RoboCop. As an anesthesiologist, let me clear some things up here. Rarely is the surgeon even in the or during induction. Going to sleep time. Usually just the anesthesiologist, or nurse, and person that helps with instruments for the surgery are present. I've heard and seen every crazy thing imaginable, including people's deepest fears and secrets. Mostly this is caused by a pre-medication such as Versed removing inhibitions. Every now and again I'll hear something that will even make the entire room chuckle. 99.99% of the time whatever you say has already been said and isn't nearly as funny or original as you think. I often hear from patients in pre-op that their biggest concern is saying something they will regret, and I always reassure them the majority of people talk a lot less, and the ones that do talk usually hold relatively normal conversations for the brief period of time of getting a pre-medication to going under full general anesthesia. Now as we are talking a case involving moderate or deep sedation and not general anesthesia. It's completely different. If I were to have surgery and the anesthesiologist not know me or my profession, I'm sure I'd do my best to prank him by saying something completely obscure about anesthesia and just give him a wink. Edit. Since my inbox is getting filled with medical questions, please talk to your anesthesiologist the day of surgery about your complete medical history. It all matters. Let him/her determine what is important to your care. Bar. Bar. Bar bar. 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 Bar bar. I wanna be sedated. Better link. Related part at 2 minutes mark. Said over and over again as long as possible until you pass out. Edit for Nata bar and a better link. This is kind of relevant, but I recently had ankle surgery, and just after waking up I looked at everyone and said already finished? That was quick. And they all looked at me with extremely annoyed looks on their faces, and the surgeon said that took us 4 hours. My wife went to the dentist last weekend. After several shots of numbing she sang to him, "I can't feel my face when I'm with you." To the dentist's credit, without batting an eyelid he replied in full voice, "Cause I numbed it." I had to get some surgery that involved cutting open my head. Right before they gassed me, I said, "I should warn you. There's a spooky skeleton in there." The last thing I remember is his response of, "I'll try to look out for that." Oh god. I feel like I'm going to have diarrhea. Get me to a toil. ZZZZZZZZZZZZZ. I was getting strapped down and the last dose of anesthesia was being administered for my tubal in August. They started to put the oxygen mask over my face and I stopped the anesthesiologist and said, "Wait, when do I get my ball gag?" A couple of years ago, while I was being prepped for bone surgery, I had good rapport with the anesthesiologist. My dad is one, and we kept talking about pain management and such. He pushed the dose of ketamine and propofol into my IV and my brain was getting foggy. I remember seeing him laughing his ass off as I went to sleep. When I woke up, my friend who was attending the surgery told me that while I was dozing off, I told the surgeon this is the very first time I tried ketamine non-recreationally. And with this the blood pact is complete. Marizo cringy rather than making the surgeon laugh. But one time while I was going under I was trying to be all cool and said, oh yeah guys, this might take a while. I totally party all the time so, and apparently I passed out right away. So much for being a party animal. I had to have a pilonidal cyst removed from my ass crack and can remember giggling like a madman because I asked the entire operating room so, who drew the short straw and has to shave my ass? A buddy of mine was having surgery done and went resebuluwood right as he passed out. When my appendix burst I was being wheeled in and as the doc was getting ready and I was about to pass out he said geez this is rusty and held up a scalpel. I could tell he was joking and off I went to sleep. When I woke up he came to check on me and the first thing he said was have you seen my watch? I do not. He was a very funny man and it really helped calm me down in a situation where I nearly died. Mind removing some fat while you're in there? The anesthesiologist and or staff were not amused when I said duck this it, ripped out my IV, rolled off of the table and collapsed on the floor. Before sedation, I was angry about the poor and uncomfortable placement of my IV. When the happy juice started flowing, my inhibitions disappeared. I didn't remember any of it, but the IV being in the other arm was the first thing I noticed when I woke up after surgery. They had me count backwards from 100. I think I made it to around 98. I said to my doctor during my wisdom teeth extraction, "Doc, don't start, I'm still awake," to which he said, "We're already done. Those drugs are legit." I just went under this past week. I told my doctor I better not wake up with any D's drawn on my face. The room had a laugh. I went to sleep, and they performed the worst magic trick ever and made a camera disappear up my ass. If I die on the table, I'm coming back to haunt you, Methodica. Unfortunately, it turns out I cannot control my volume when the drugs are starting to kick in. So I shouted that at the top of my lungs across a crowded pre-op room. Scared the hell out of the other patients. Doesn't always work out. I said, "Hey, didn't I see you at the bar late last night?" Double quote. He replied, "That's not even remotely funny, and I don't appreciate you saying things like that." I'm 100% sure he purposely left scar tissue in my nose. Similar, I had some kidney stones, and they had to go up there to unblock my parts, if you know what I mean. As I was waking up from anesthesia, I apparently asked, "How many people saw my PP?" Few minutes later, as I was a little more coherent, I asked the nurse what's the craziest thing she heard from someone waking up from anesthesia. Her answer, "How many people saw my PP?" Good times. If it starts making ticking noises, just ignore it. It doesn't go off most of the time. If you say anything that will create issues regarding the outcome of the surgery, that is, prior health issues, wrong surgical site, etc., fully expect your surgery to be cancelled and you waiting to go back again. Also, this is very dangerous as surgical practices. Well, practice. Your surgeon, anesthesiologist, CRNA, if present, PA, RNFA, scrub, etc. are all there to make sure your surgery is as safe as possible, but it happens. I haven't been this excited for nap time since Sally moved her cot next to me kindergarten. Okay, so I know this is late in the thread, but when I was 15, I discovered that I could pull my foreskin back behind my D head. Needless to say, my foreskin was so tight I opted for circumcision. My doctor, Dr. Lentz, was the funniest dude I've ever met. Told me my D was gonna look like Frankendy for a month or two, but it's cool. Anyways, I'm in the ER on Christmas Eve and I feel the anesthesia starting to kick in. And before Dr. Lentz walks out, I shout, "Slur doc, please, just take care of the little guy," and he stops, turns around, bows to me and says, as if he were my own, I laughed once then passed out. Daisy. Daisy dart javi dart mia on swear. Dugaru dart I am half. Kraz I.